Welcome, everybody, to another edition of Everyday Health Hacker. I'm Mike Hersing, and this nice young lady next to me is Dr. Liza Leal.
Hello, everybody. Welcome back. We can't wait to talk to you today about peptide therapy.
We're going to do that. All right, Dr. Leal is the Chief Medical Officer right here at Meridian Health Institute in Sugar Land, Texas, and this is where you want to be. These people have been around forever, and they've been doing it the right way forever, since the beginning. And the right way is, and we talked about that, you use the natural approach as much as you can. There's times that you'd say, look, you need to take these antibiotics, you need to take this, we need to get this knocked out. Okay, or come in, I'm going to give you a shot, we're going to get this antibiotic thing, we'll get sickness over it, that's fine. But you can also tell me, or other people, like, let's do it this way. There's no drugs involved, we're going to do it natural, and let's make that approach.
Yeah.
That's a cool thing about you. You are open both ways.
Yes.
You're not, whatever works the best for the patient.
Correct. And sometimes it's a trial and error. You know, I always share with people, it's like, let's be open to trying it 2 or 3 different ways to see what we can do to optimize it. And sometimes we hit it right on the first one. And sometimes, we're going to start with a little bit and then we're going to add a little bit more. Especially like with hormone therapy, a lot of women will say, well, can I just go up to the highest dose? I'm like, no, because if you go too fast, then you're going to gain weight, and no woman wants to gain water weight. So there is a titration is what we do. So that's a little bit different. Then we might add a little bit of something to it so that we can know what untoward effects that they're having. So we want to know what's working well for them. So like with hormone therapy, we've got peptides and then we have natural hormones as well. And a lot of times it's going to take them a good 3 to 6 weeks to have a good feeling about it. With peptides, there's some peptides that we notice instantly and some peptides that we notice a difference in 2 to 3 weeks. So
that's popular right now. Peptide therapy has become pretty popular.
Yeah, we've been doing it for 30 years.
Yeah,
so
I'm saying
it's kind of like it's
like everybody goes, hey, have you heard about this? Goes, yeah, we started that 30 years ago. So that's the funny part.
There's more choices now, which is nice. There's definitely more choices. We use a lot of Somorelin, different things to help with the functioning of our, not just losing weight, but building our muscle mass. And as we get a little bit older, it's hard to maintain our muscle mass no matter what we're doing and working out. So that helps a lot of our older patients. And when I say older, I'm talking about us over 40, some of us 50 and over 60. We're all getting up there. And then, some of my patients are concerned about hair restoration. They're going just absolutely mad. They don't want to go in and have a whole new transplant. So we can do things like IPRF, where we take their blood, we spin it down, we add a peptide to it, and we do a little microneedling into the scalp, and that brings the hair growth back. And it's really nice when they're saying, my hairdresser noticed such a big difference. And this is a difference that we notice in 3 weeks. So that's beautiful. I usually recommend 2 to 3 visits in order to see a consistency of that.
Wow, I mean, that's
really
kind of cool. You guys do all kinds of amazing things now. And it's just, she's got this little smile, It's just,
it's fun. It's fun to see people feel good, especially when you see them and they're coming in with difficulty walking, difficulty being able to move because of pain, and then you get them to an optimal weight, you get them to optimal abilities. The whole idea is that we do practice what we preach here. Even our dog, Denali, she practices what we preach. Here she is, 12 and a half years old. She has no gray hair because she does what we do on the veterinary side, obviously. And we're just so excited to be a team here and to help people. It is our passion, and we want everybody to feel well, have energy, so that when they come home from the office or from work, that they have the same energy or more for their family.
Yeah, it's tough. It's one of those, I'm too sick and tired to be sick and tired.
Absolutely.
And you just go and you watch these commercials on television, and the people are dancing and they're talking about this and talking about that, and I'm going, I want to feel like that. I want to do that. Okay, I'll go take that whatever ridiculous medicine.
That's
and then they
$2,000.
That's 5 minutes of, by the way, it could cause your arms to fall off, and this, that.
A lot of side effects.
Yeah, all these side effects, and you're going, well.
That's the beautiful thing about amino acids. It's naturally occurring.
Right.
So you don't have a side effect.
Why doesn't everybody do this?
Because a lot of people just aren't aware. They're not aware because we see television, we see magazines that are giving us outside information. And that's part of why we did this YouTube channel, was that we shared a lot with our patients to give them some information, like who's a good candidate for peptide therapy? Well, really anyone is. Whether it's you want your skin to tighten, whether you want your hair to grow back, whether you want better libido, just from an
or all of the above,
anti-aging,
or all of the above.
longevity. I just want to feel
Sign me
better.
up, sign me up, coach. Put me in.
So all of that is part of what peptide therapy is. And it's just about feeling good, having the quality and the energy to do what we do. A lot of women, they're in...
Let me get my wallet. I'm going to give you my credit card right now.
The vice president, a lot of vice presidents, they'll come in and they'll say, I'm in a meeting and all of a sudden I forget my words. And I'm like, yes, you're having mental fogginess. That's your progesterone and your testosterone. But it's also amino acids. So we can put those all together so that you feel like you are on without having palpitations from another medication that could be a side effect, some of the medications.
It's like, I had this and I can't sleep, or I can't go to sleep, I can't do this. Well, what are you taking? Oh, you're taking this, and then it's
and also nutritionals. Nutritionals can also cause palpitations. They can also cause unwanted side effects. They can interact with medications. So the more natural we can get things and really work with informing the patient of what they're taking. When it comes to nutritionals, it may take 3 months before they feel a difference. Sure. Whereas amino acids, it's going to be probably about 2 weeks before they'll notice a difference.
Guys,
so that's pretty quick.
That's a big deal.
That's pretty quick. And amino acids, you take them with a little, it is an injection, so it's a subcutaneous injection, so really tiny. It's like a mosquito. For those of you in the South, we all know about mosquitoes.
Oh.
And it is super simple. And one of our next videos, we're going to do a short on it just to show you how we draw it and how we give it. Very simple to do.
It's
and
very
it's a tiny
simple.
amount.
I'm going to take allergy shots for all my, and this is half the size of the
needle. And this can help you build up your resistance to having allergies.
We're talking like the cars are all yellow from all the pollen and things like that.
Yes.
And it makes people crazy. And, certain states, they don't have it, but they will soon.
They have it in Texas for sure.
It's terrible.
Everything is yellow. Everything on the floor is yellow. So it is definitely cedar fever is what we're calling it out here.
Yeah.
And, this is just another option to have something different to add to your repertoire for anti-aging, longevity, feeling better, having more energy, so that when you go home, you have the time and the opportunity and the energy to do something that you want to do.
You don't spend the afternoon or the evening looking at WebMD trying to figure out what's wrong with myself and then screwing it up even worse.
Yeah, don't do that. We always share that.
It makes her crazy. It makes her crazy.
Patients will always say, well, Google said this and Google said that. I said, well, did Dr. Google give you a prescription or any recommendations? And they're like, well, no, they can't do that. I'm like, okay, let's get started. Let's find out what we can do together.
I would be, after watching all those commercials and all this big pharma, they're talking about maybe taking that back off the air. I think that'd be wonderful. I mean, I like watching those even less than I do political commercials. It's just...
Yeah, that's where I pause it, wait till it passes, and fast forward.
It's like watching SPCA commercial that you'll
yeah, but then you want to save all the
you want to save all the puppies and stuff like that. But this is actually, you guys have answers for this stuff.
And if you want more information, you can simply just go to our website. A lot of people, there's a lot of different peptide therapy websites that are out there. Ours is Meridian Health Institute. Also, that's an interesting notation. Also, meridianmedicaldental.com, and we'd be glad to answer any questions. You can also just email us at info@meridianmd-dds.com or info@everydayhealthhacker.com.
You can find them, trust me.
Yeah.
And you just look at you can go to LinkedIn, you can go anywhere to find these folks. Just for Everyday Health Hacker. Do a search for that, and I promise you, she'll show up.
Yes, and as our audience gets to know more about peptide therapy, then we'll delve into the many different types of peptide therapies, what we use for healing, what we mix together, what we want to use for skin, all these different things to help us look naturally and also physically feel better with the mental acuity to feel better as well.
And it's easy, folks. All you gotta do is find, and the reason your doctor may not be doing it, maybe they're not aware.
A lot of doctors have shared with me when I ask them about it. They're like, I can't add one more thing to
That's right. They just can't. And then also they may have big pharma. That's the other thing. I hate to say that about doctors, but it's
okay. Every doctor's office is a little bit different.
Right.
We look at Meridian as that, this is something where everybody becomes part of our family. So we're going to treat everybody like our family. And so what we do, we are encouraging other people to do so that you can have that best life with the longevity that you desire, with the quality of longevity.
Yeah. So if you see drug reps walking in your doctor's office and everything, you might take a few things with a grain of salt. That's just me.
Okay.
She won't say anything about it, but I will. How's that?
Well, we hope you will subscribe, and we hope that you will leave us comments. If you've tried peptide therapy or you are wondering more about it, send us a little note or a comment and we'll be glad to send you some information.
I'll let you know because I'm going to try it, I think.
I know you will.
I know you will. Have a great week, folks.
See you soon.